The reality of coronavirus may not be in doubt, but the conspiracy theories and alleged secrecy in the management of the virus may have accounted for the lack of trust by the people. Recently, Abia State Ministry of Information took some journalists on a guided tour of the Amachara Isolation Center. The mission was to confirm the number of index cases at the center and interact with frontline health workers on their management and treatment. For some level of privacy for the patients, the cameras could only get to a point.
NCDC standard is that you collect a sample. That sample has there are two sides to it, the oropharyngeal and the nasopharyngeal swabs. So you collect two swabs with which you do the test. And you know we don't do the tests here. They are done in NCDC accredited labs. And when NCDC has positive cases, they confirm it in the lab before sending to the state. So we sent them the samples and they sent us the results. We only take people that have positive tests into the isolation. If you have a probable result, if your result is indeterminate, we repeat the test. This is the isolation word for confirmed cases, not suspected cases. Five males. Okay, the sixth person is in FMC. You know how NCDC reports cases. Even if you had a positive case 2 months ago, they will still report the cases as so-so number until you discharge. When you discharge, they now add those that are still on admission to your new cases. That's why you hear that Abia has 6 cases. It's not that the 6 were diagnosed at the same time. We have one case, which was one of the index cases that was diagnosed since, and then 5 new ones that were added. You know, when they get positive results, before they even publish, they contact the state. So those 2 results, if you heard the governor's broadcast, he said 5. But if you look at NCDC calendar, they first published 3. These 2 you are seeing now are part of the 5. We already had the information in the state, but they published it when they were sure we already had the information. So that's what NCDC does. They make sure the state gets the information first before they publish it. This one is 10 bedded. This one is another one that has 100 beds. There's no probable case that we admit. We advise the person. Like I told you, we have a case that is indeterminate. We advise the person on how to self-isolate in the person's house, pending when the other results will come out. Okay. So we don't bring, only confirmed cases are brought here for isolation and treatment. Okay, FMC has a small isolation ward. Okay, and since that ward cannot take these men here, that's why we had to bring them here. The capacity of that ward cannot take them. That's why they're here. That is now my message to the public. My message to the public is, please listen to expert advice. If we tell you do 1, 2, 3, please do it. We're not just looking for what to say. We're telling you what will help you, what will help your family and the people around you. So don't tell me they don't want to, they will not. Let us encourage people to do the right things. If you're advised, do this. Please try and adhere. Our prescriptions, we don't, you're not medical people, we don't give you our prescriptions. Exactly, that's why I said we don't give you our prescriptions, because you don't expect us to be telling you, patients have rights and privacy. You don't expect us to be telling you, Mr. O, we are giving 1, 2, 3, 4. That is the patient's privacy. Yes, so the beauty of this interview is that we had one camera go in to see the patients and then to come back and relate the videos. You can't make up such videos.
By the time you wear that overall, you start sweating immediately, you start burning inside. So, and you have to do that for about over 1 hour. You'll be with the patient, taking their vital signs, treating them. So it's very, very sad. It's very, very challenging. It's a period when you're going, you're making up your mind, ease yourself, because you don't want much tension apart from the tension of the heat you pass through inside and thinking of, let me not be infected by these patients. You understand? So it's a horrifying moment. Seriously, medical, it's just, I have a passion for seeing the sick alleviate or get better from their sickness. But if not for medical wood, if there's anything better, I would do. But this is a risky venture. If you get it, there's no probability that anybody will live. So we don't know who. It's not written on the face that this person will recover or this person will not. So that's why we are doing as much as we can to keep ourselves protected from this virus. I go in there like 2-3 times a day. I fully kit. You see the way we kit. Seriously, by the time you come out, you ask some of them that went in, you'll be sweating. I will be drenched. You see, this microlot will be drenched because heat inside. And you just truly, if it's about pay, they're not really paying. The pay is not commensurate to what we suffer inside there. We are being fed, we're given accommodation. The remuneration, it's something they agree. I think we are doing well for now. But if there's anything that could be done to increase it, we'll be very happy, because this is not sufficient, truly, for the risk we are passing.
We'll have 100-bed isolation this year. We'll have about 11-bed isolation this year. This is isolation and treatment center. There are two different things. This is an isolation center. Like this building now under construction is a holding area. That's this one now, holding area. If you have any alarm, raising alarm, look at, you can keep those people there. Collect their samples. Then they remain there. Then once you test the samples and anyone that comes positive, you move to isolation and treatment center, which is inside this place. And that's where we have our patients now. So any other case we'll move it to isolation too. But they're not confirmed COVID-19 cases. If they are confirmed, they move into isolation and treatment center. There are two different things: isolation, then isolation and treatment. It depends on your conduct. The conduct of the city. If you have the belief that the COVID-19 is real, then you comport yourself, follow the guidelines of NCDC, and you reduce the spread of this virus. And once it's reduced, then the pandemic can be controlled. So I wouldn't just say we expect to get 200 cases or one case. No, it depends on our conduct. Personal hygiene, wear your face mask, and all those protocols must have to be observed. And once you do that, you have to limit the spread of this virus. Now, this is not a death sentence. Any person can have it. It is not sexually transmitted. Do you understand? So, as we are talking, we can have it. And even without some treatment or whatsoever, depending on our level of immunity, we can survive. And if you test again, it becomes negative. So, once we test somebody is negative, he's reintegrated into the society. He goes back to his homes and now he enjoys with his people. What actually happened was, because of porosity of our borders, some of our borders, and the Lagos State Health Commissioner just mentioned it yesterday, that most of their tested and confirmed cases of COVID-19 ran out of the state and started heading back to their villages. So now what these people do, anyone that comes into the village, if they see that person in the village, they are coming from Abuja or Lagos or Kano, they will raise alarm. The villagers will raise alarm, and now they will report to us, will come straight to you, pick them, and then do this, collect the samples and run the test. And that's how we got the last three. 3 of them came, and we were able to get them. But they are neighbors. The people the people they interacted with were just very minimal. Yes, the uncertain case one is uncertain. That's the test result is inconclusive. That's what it means. Now what happens is that isolation, that patient requires an isolation. If you cannot isolate yourself well in your house, because a retest sample has to be collected immediately and sent to the lab. So if it now comes out to be positive, move you to isolation and treatment center. If it is negative, the advice is one, we will try as much as possible to help ourselves. We should all know that this viral infection is real and is with us here in this state. Observe all the protocols set aside by the NCDC, social, physical distancing, wear your face masks, observe all the protocols, and then personal and environmental hygiene is the key word. By that, you are helping the state. If you have any case of influx of people from anywhere, just report to the law enforcement agents and they'll come and arrest the situation. That's what we can say. Stay safe.
Thank you very much, and I agree with you that it's a very serious issue. First, our people must know that those who go down with COVID-19 have not gone down because of their sins. No Abian brought COVID-19 to the world or to Nigeria. Now, we understand that this is an infectious disease, that people should stay away, maintain social distance and all that. But it doesn't call for stigmatization of individuals involved. We strongly condemn acts of stigmatization, and I need to warn that if it continues, not many people will be coming out to call the contact number 0700224236 to report incidents. Let me also use this opportunity to thank the great people of Ofeme, of Afugiri, and indeed of Olokoro. These three communities on their own reported that they have received visitors from outside the state. They didn't know whether they had COVID-19 or not, but they did the needful. They reported to us, and we came over, collected samples, tested, and we have 3 positive cases. Now, nobody should stigmatize people living in those communities. As part of our contact tracing, all those who had contact with these confirmed cases will be tested, especially those that we believe are very active contacts. They will be tested, and based on results gotten from other, especially our index cases, I don't think there is anything to worry about. Because if you look at the test carried out with those who had contact with the index cases, all of them, including the medical doctors, were COVID-19 negative. So there is nothing really to worry about, except to submit yourself for test so that we can be sure that you are COVID-19 free. I want to once more congratulate our people for their vigilance and to ask them to maintain that level of vigilance. I visited our brothers in isolation today, and I'm happy to report to the people of Abia State that they are being well taken care of. Nobody is happy to be in isolation, that much I am sure of, but they are confident. We believe as a government that with the management regime that they are going through now, in less than no time, they should not be out of here and return back to their family. Please do not stigmatize anybody because the person is COVID-19 positive. It could be you, it could be me, it could be anybody. Nobody deliberately moves to go and infect himself with COVID-19. What is important is that we should take all necessary measures to ensure that we protect ourselves, our family members, and our community. But nobody should stigmatize anybody on account of this illness. You see, every system that involves human being policing the system already suffers a weak link, because nobody can determine how you, Obiomo Broga, will behave in the presence of money. And that is the problem we have in Nigeria. There is an order from the Commander-in-Chief of Nigeria's Armed Forces stating clearly that there should be restriction in interstate movement. We begin to wonder, should we actually be policing borders in Abia State? Because actually, we are surrounded by about 7 neighbors. If they all shut down their borders, nobody can come in here. So you begin to ask, how did they leave Sokoto and get to Abia State, passing through about 13 states? How did they leave Lagos and get to Abia State, passing through 8 states? All of them on border movement restriction. And then when they get here, who is this individual that does not understand that the 1,000 naira you've taken to allow somebody to pass would have endangered the whole community? Let me give you an instance. We are very lucky that the current 3 cases that came from Lagos, that we got to them early because of early reporting by the communities. Otherwise, you can imagine the loop. I'm not sure that any of them is from a community of up to 300,000 persons. But you can easily guess how the loop will be if it gets to the point where our people will have to trace everybody they had contact with over a period of 2 weeks, for instance. You are probably thinking about 1,000 plus and so on per community. And that will be inconveniencing. And that is happening because somebody took 1,000 naira at the border. I don't know if you understand me. So we need to all do our jobs. The government will continue to push, but what is important is that this is a federal government directive. And it is shocking that security agents are refusing to obey the commander-in-chief. Because that's what it amounts to.
So what we want pressmen to help us do is to tell the general public that COVID-19 is real. It's not really exciting caring for them. If you wear that PPE, ask the cameraman that went in, if you wear that PPE for 30 minutes, then you know the discomfort that the health workers are going through managing this patient. So nobody will just be saying, we are managing COVID-19 patients for the fun of it. It is not funny. It's not. So please help us tell the general public that it is real, that you have been here to the center and we wanted to protect you. So we said you can't all go there. You will not be able to take the IPC procedures, the infection prevention and control measures. You will not be able to take them. To wear that PPE, you are supervised. To remove it is even more taxing. You are supervised so that you don't infect yourself. That's why we wouldn't take all of you in there. So please help us tell them that it is real. We have 5 patients here on admission. We're managing them and we'll be glad if we don't get more. But if indeed we get more, we will also manage them. Another information I want to also the press to take is the fact that people have relations that have come back home from various places. If you have a relation that came back from any of these places, Lagos, Abuja, where they have cases, please alert us. You can reach us privately, alert us. And your first responsibility is to keep that person in a form of quarantine within your home. Let that person not freely move and interact with everybody. Alert us, let us collect a sample and know if this person has it. If the person has it, we'll manage the person. If it becomes negative, we'll send the person back to you and the family is happy. So we need that commitment from families and the public.